This episode of Ask the Doctors is being brought to you by Wayne County Government.
Beyond the Church Walls and WCTV has joined together to produce a PSA to encourage people of color to protect themselves and to protect their families by taking the COVID-19 vaccine shot.
I'm Elizabeth Bennett. I'm a retired registered nurse who worked 47 years in the community. I'm willing to take the shot.
Are you willing to take the shot?
Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh. Thanks for joining us for this week's Ask the Doctors program. Need to start by saying thank you to Jason Troutwine, who did a last-minute sit-in for me last week. I always appreciate it when he's able to do that for me. And thank you again to our doctors for once again being here. I think we're about at week 44. Gentlemen, this just keeps going, but hopefully through this we end up with some good news. Our doctors are David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President Medical Affairs at Reed Health. It's been a better week, I would like to start off by saying. I think numbers are coming down. There's not as much red on the state map. Dr. Huth, I'll let you start because maybe your staff is actually getting a chance to breathe just a little bit.
Yeah, when we get to the statistics, we'll see that we still have a fair amount of COVID-19 in the building, but compared to, 6 weeks ago, it's much more manageable. And yes, people feel like they have more opportunity to kind of focus on other things, and so a lot of folks have been stepping forward to help us with vaccinations at the Kuhlman Center, and that's been a very exciting thing. I was there about 5 hours this morning helping with doing vaccinations, and just really fun to see not only the Reed team I was very excited about being there and performing that service, but everybody that's coming in was really excited to get the shot, and so that was really nice to see.
Good. Dr. Jetmore, what's your week been like? Have you driven the new bus yet?
No.
Come on.
No, I haven't. I'd have to fight.
It's a little bigger than a motorcycle.
I'd have to fight Christine to get to the steering wheel, I think. I think that's one of the big things for the health department. We've taken delivery of our mobile clinic, and this will give us the opportunity at this point to go out into the county and set up a mobile clinic and vaccinate at-risk people all around the county, some of whom find it hard to travel or get out of their homes. This is a fantastic gift from the county. I think we're very grateful for it, and we'll certainly utilize it. There's a picture of it. I'm not sure I can drive something that big, Eric. I
was going to say, you're used to the motorcycle or something.
I'm going to try it back and forth on the parking lot before taking it out on the road. I would hate to wreck it at this point. But yeah, there's a picture of the outside of it. We just took delivery of it today, and it's sitting on the south parking lot at the Elder Bierman site. So if somebody wants to drive down South A Street, they can check it out. But we hope once we get more vaccine, I mean, that's our limiting factor. It's a limiting factor everywhere, I guess, in the United States, is we just need more vaccine to roll out. And there are a lot more vaccines that are right on the horizon of getting FDA approval, so emergency approval. So I'm hopeful about that. But as you say, all of our numbers are coming down. We're heading in the right direction. And I think it's because of people social distancing and wearing masks and taking this pandemic seriously. And we're starting to see the results of that.
What are the numbers like that you all are able to do at this point at your various facilities as far as vaccine? And what are the doses you think you'll be able to do? Obviously, you're not at max capacity by any stretch of the imagination. You both said you need more, but you're getting some and you're getting people through. What's that like for you?
We get 600 doses a week, and we vaccinate 120 people a day. Some of the vials in the Moderna vials have an extra dose. If you can draw up a full extra dose, you can use it. So some of them have 11 doses instead of 10, and we'll make use of those. We've talked to the state about giving us more vaccine because of this mobile unit, and just because we have the capacity of doing probably 500 to 1,000 patients a day. If we had,
and that's just at your Elder Beerman site.
Just at the Elder Beerman site. Tom would probably like to add to this. I know that you're getting more vaccine because you're dealing with a much larger populace, a 4-county area.
Right, and plus we're dealing with the Pfizer vaccine, which is in more plentiful supply than Moderna, but we get Pfizer because we can manage the storage requirements for it. And I think we could do, if the state could send us enough vaccine, we could do at least 1,000, maybe 1,500 vaccinations a day. This week has been tough for us because the volumes have been low. We have lots of openings on our schedules. And there have been some problems with the 211 number. We are encouraging people not to use the 211 service preferentially right now because they have some issues with being able to see our site and give people accurate information. We're working with the state on that. And so you'll see soon in our media, our advertising on that, use ourshot.in.gov or call directly to the Kuhlman Center, and there'll be a phone number for that, preferential to using 211, because we've had many folks come in who've said that they called 211 and were told that there were no vaccinations available in Wayne County anywhere until the middle of February at the earliest, and then only at the Wayne County Health Department. But I'm sitting on 200 plus open appointments a day right now.
Okay.
So we have plenty. If you go to ourshot.in.gov right now, you will see plenty of vaccinations that you can go schedule for today, on a today basis, tomorrow, and so forth. So there's a mismatch. There's a disconnect with the 211 service, and we're still dealing with an age grouping that need help. So they're less likely themselves to get on ourshot.in.gov, and will need a live person to help. So we request that they, at least for the moment, use our folks to be that interpersonal in between. But so we could do a lot more than we are doing right now. I actually have on hand something around 3,000 doses of Pfizer right now that we want to get used up as quickly as we can so that the state will send us more and we can continue to kind of expand that. But we have this little glitch this week. Next week will be higher volumes because there will be more people coming back for second shots. And we still have a little bit of Moderna that we need to give out. But we will and we may still do some first shot Modernas, but then we'll schedule them for their second shot with the health department where they can more reliably get the Moderna, which we prefer that they need to get the same product for the second shot.
Are we still at the 70 or above, or have we actually come down to 65? And that gets to be a little bit confusing because you hear, well, maybe next week they'll start, but we don't know where we are.
I think that we're in this weird place. I've talked about how I've got plenty of vaccine right now. I've got open appointment slots. Mm-hmm. People can't get to them. However, on a larger level, the state is having problems with its own supply chain on this, and so we all thought that the age limit will be reduced this week, but they chose not to do that. They're saying next week possibly will go down to age 65. And maybe go down at 5-year increments from there. And
they keep getting closer to me.
Keep getting closer. It's going to feel like it will take forever, but you mentioned that you can sometimes get an 11th dose out of your 10-dose vials of Moderna. With Pfizer, we can pretty reliably get 6 doses out of what's supposed to be a 5-dose vial. And so out of every tray of 195 vials, we can pretty much reliably get about 1,170 vaccines of what, if it were 5. If you were only getting 5 doses per vial, it would be 975. So we're getting extra doses, significantly extra doses out of those vials. And so we're not wasting those. We're trying to put them into somebody's arms. And so if, like a day like today where we don't have that many people scheduled and a younger person comes in with an elder person to help them, or like, hey, I got an extra shot. Do you want it? We're giving out extra shots to whoever will take them. So I think right now is a great time to bring family members in who really need the shot, and and sometimes if we have the extra vaccine, those who are accompanying them will have the opportunity as well.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We will be taking your questions. We are taking your questions, actually. You can put your question on our Facebook page, or you can send a tweet to @WCTV Info. We'll be getting to your questions here in just a couple of minutes. We do not have a guest this week. Plenty of time for questions, so if you have something you want to ask one or both of the doctors, you can get those questions in. The Johnson & Johnson vaccine seems to be creeping closer to approval. Its efficacy rate, from what I'm hearing, is a little bit lower than the other two, but it's a one-shot dose. Anything that you all want to put out there for those folks?
Well, one of the things I think Pfizer and Moderna have set the bar so high at 95%. Actually, there was a recent study in Israel where it was over 700,000 people that have received one or the other of these vaccines, and they found an efficacy rate of 99.4%, which is an amazing efficacy. Normally, you're pretty happy with a vaccine. A vaccine gets above 50%. You start getting it's beginning to be a pretty effective vaccine. Obviously, the more efficacious it is, the better. But people have to remember, even though you might get COVID from one of the other vaccines, and that's true of any of these vaccines, usually the cases are much milder, and usually it's not going to be a case that is going to put you in the hospital or in an intensive care unit. So even though you might get COVID, it's going to be mitigated by the vaccine.
You're not. I have to catch something, because if someone else heard it, I thought I just heard you say you might get COVID from the vaccine.
No, I say you might get. Well, thanks. I probably misspoke. If you get the vaccine, you may still get COVID. That even includes, in the Israeli study of 70,000 people, some of those people got COVID even though they had the vaccine. We've never come up with a vaccine that's 100% efficacious that I've heard of, but that Moderna and Pfizer come very close.
You're watching Ask the Doctors on WGTV Channel 11, and I didn't mean to get you there, but I know if somebody heard what you said, it would be
I appreciate all interruptions, Eric. That's fine.
The Johnson, by contrast, the Pfizer Moderna are in the 95+% range. Effectiveness at reducing the likelihood of getting symptomatic COVID-19 disease at all. By contrast, the Johnson & Johnson's probably in the 60 to 70% range, which is actually still really good.
Which is a great vaccine.
Makes people sound like it's oh gosh, only 66%.
Just out of curiosity, what is that in comparison to what we think on an average year the flu vaccine is like?
A good year, the flu vaccine is probably about 35% efficacious. It runs between 25 and 35.
Okay.
Yeah, so, probably the bigger question, and I think you kind of referred to it, is with all of the vaccines, that I think there's pretty good evidence that it's not that you can't possibly get COVID-19 afterwards, but those who do seem to have less severe disease. And that was true in the data that Johnson & Johnson is submitting to the FDA as well. And there that level of reduction is in the 80+% range. So really it's still a very good vaccine. And obviously it has this advantage of being one dose. And in that one dose is probably actually has more efficacy than one dose of Pfizer or Moderna. So if you're only going to get one shot, the one you want is Johnson & Johnson. And I think I heard that they're going to do some studies on would a second shot later on be helpful with Johnson & Johnson, and I'll bet that we'll find that that's the case. So I think when you put it all together, it probably performs about the same level as Pfizer and Moderna, actually, if you really had it on a side-by-side comparison basis in every respect. And so I think it's going to be a good vaccine. They've submitted their request for an emergency use authorization to the FDA, or are supposed to today. But they published informally some of the statistics we're talking about now, and they seem very confident in it. Hopefully it won't take very long for that to be approved. But like virtually all the vaccine makers, they already know they're having problems with their production capability and are not going to produce it initially at the levels that everybody, even they, had initially hoped would be the case. And that seemed to be something that's afflicting all the vaccine makers right now. I don't understand all the reasons for that, but it's a challenge. And there's another one that's been approved in some places in Europe. The AstraZeneca's vaccine is having huge manufacturing challenges, and have the European Union up in arms about not being able to keep up with their contracted delivery rates. And so it's not just Pfizer, not just Moderna, not just Johnson & Johnson. It seems like all of the big vaccine makers are that way. There are still, I think, more than 100 vaccines at some stage of development. Some of them are beginning to fall by the wayside. I noticed the other day that Merck, which is a big multinational pharmaceutical company, have abandoned the 2 vaccine candidates that they were working on because they underperformed in the phase 1/2 trials. So they're going to concentrate on other things and not on vaccine development. I'm sure they're eyeing the competition. They'd have to start over. They'd be way late to the market, and these others will be too established to really be able to compete. So there's not much point in them getting back into that. Is how they're reasoning on it. But I think there'll be some other of the vaccine candidates going by the wayside, and the big winners will be the ones that have gotten there first, and it'll probably be these 3: Pfizer, Moderna, Johnson & Johnson. In other parts of the world, some others are bigger. The Russian Sputnik 5 vaccine is
I'd never heard the name of it
yeah,
before.
that's what they call it. That was the one that they approved in Russia without doing phase 3 trials, and so it got a lot of press for.
Did they ever publish an efficacy for that? Or
I've not seen
they
it.
had any way, well, since they had no trials, they probably couldn't recover that data. I
I've
saw
not
that
seen
they
it.
were selling vaccine to Bolivia and
Right.
Argentina.
They've been selling it all over the world. Middle East, India, South America have been buying Sputnik 5 vaccine. So I don't know. It's interesting, all this vaccine stuff, but the real, that's all by the side. What's a concern to me is the supply problems that we're seeing, where the state is not keeping up with deliveries the way we were sort of promised, or led to think that they would be.
Mm-hmm.
Hopefully that will straighten out soon. Meanwhile, I actually have vaccine and can give it to people if they'll simply sign up and come get it.
Ourshot.in.gov. They've got vaccine. They want to put it in your arm. This is Ask the Doctors. I've gotten some of my questions in. I could probably come up with 3 or 4 more, but let's hold those and let's see if we have some questions from you. I don't think that's a question.
Ryan felt
Well, I
the
saw
need
a
to
question mark in
advertise.
there somewhere.
If we get to yellow, will that open up the county more? Will that affect the amount of people who can congregate in buildings?
Well, yes, it will. We're at orange right now, and that is, there are two factors that drive that: the positivity rate and the number of people per week per 100,000. And we're okay on the positivity rate level. If we get our numbers below 200 per 100,000, then we'll be a candidate for the yellow designation. And they will be able to have larger gatherings. Christine Stinson and I were talking about this today, about easing up some of the restrictions we've had on the schools as far as cheerleading and number of people that can attend sporting events. I think, I can't give the exact number. It gets liberalized at each, at the closer you get to blue. But the short answer is yes, there'll be more allowance of gatherings in terms of numbers.
It still won't ease the social distancing. It still won't ease the mask wearing.
No, we've got to continue to wear masks and social distance. You know, I was reading, you know, the number of people in the United States that have had both are fully vaccinated is just a little over 1%. So, you know, it's important that people not get too complacent when they see these numbers, because our behaviors cause these numbers to come down. Our, you know, masking and social distancing have caused these numbers to fall, and not the vaccine. I had someone asked me the other day, boy, it's great that this vaccine's causing these numbers to fall. Eventually that will happen, but we just haven't reached that level yet.
Okay. Next question. How can a homebound person get a vaccine shot? There's probably a lot of that question out there right now.
Well, that's a great question, and you know, unless somebody physically has some vaccine and goes to that person's home, we don't have a route for doing that at this time. The thinking has been people who are homebound, in other words, don't have contact with other people, are very unlikely to get infected. And so they haven't been as prioritized as some people might have thought they should be. But that will be coming in the future, and that's one of the reasons we were so excited about getting this mobile clinic, because we can go into some of these small towns and actually take these vaccines to the patients.
One of the things we're hoping to do is get in touch with Christine this week and maybe get some video of the inside of the mobile unit, be able to show a little bit more next week, gives people an idea of what that is.
We wanted to give you that teaser first of the exterior of the vehicle.
The exterior looks great. I've already got my staff going, can we get a production truck that looks like that? What? Next question. I recently read an article that suggested wearing 2 masks may have some benefit. What are your thoughts on double masking?
Well, 2 masks are better than 1, but where do you draw the line? I mean, I just wear 1 mask. It's intuitive that 3 masks are better than 2, and so on.
That could get a little thick on the
yeah,
although it's going to be pretty cold this weekend, so you know, you might want to do a double layer.
You might want to wear that. But yes, I think studies have shown, and it's intuitive that would be true, that 2 masks are better than 1, and if some people are in a situation where they feel like their exposure to COVID might be greater than normal, then I certainly wouldn't fault them for wearing 2 masks. What are your thoughts, Tom? I'm sure you have something to add to this.
You know, it makes sense, you know, that I can't argue against doing that. And I think that I saw a picture just this morning of President Biden wearing 2 masks. He was wearing what looked like the edge of a KN95 or something with a surgical mask over it.
I've actually seen that on a few people that have maybe stepped to the podium during speeches this week or press conferences this week.
And yeah, it's defensible. So I wouldn't, if somebody is concerned about it, like particularly if you work in high-risk situations or live in a high-risk situation, yeah, maybe that makes sense. I mean, that's kind of what we do in a sense with active COVID-19 patients in the hospital, we wear N95 masks, and often you'll see folks with a surgical mask over that. But that's really that's less about additional filtering capability and more about keeping the N95, surface of the N95 clean, so you have to change it less frequently. You change the surgical mask, but not the KN95 more frequently. So, and I don't know if there would be situations where there could be other reasons than additional filtering capability where that would make sense. I guess is the point on that. So, but I'm not aware of any data, really. I guess I'd have to go research it. Is there something published that I've missed that wearing 2 masks is significantly better than 1 in, say, general life situations? So where it makes sense that you get some additional filtering capability, but the reality is, at a certain point, the additional benefit kind of diminishes. You reach a point of diminishing returns. So do you really get, if I'm going to the grocery store, do I really get that much more benefit, or do I impart more benefit to other people around me by wearing 2 masks as opposed to 1? I've not seen any research on that, so people are free to do that, but it's not really what I plan to do until or unless we learn that it makes sense to do that.
We may have a question buried somewhere in there, but I'm going to go ahead and bring it up a little bit. The variants that we're finding in this, there are 3, 4, probably more than that out there. Are those troubling right now? We're hearing that the vaccines that are out there are handling at least a couple of them well, but they're also talking about needing boosters. We're barely getting through 1%, and we're talking about needing boosters. Are we going to end up with vaccine fatigue at some point from people? Constantly going back and getting updated?
Is it troubling? I'm not troubled by it because it's kind of what I always expected to happen, because we know that these viruses go through mutations. I've referred to many times that actually there is a website that tracks all the genetic variation as it's discovered and cataloged, because there are research academic organizations around the world that do this kind of work, and they compile it in places, and you can actually go to a website and see that there are over 5,000 families of genetic variations that are detectable. That all those genetic variants don't necessarily have any significant effect on the resistance of the virus or its transmissibility and so forth. But these particular ones that we've been hearing about, the UK one, and it's also called B117 or B.1.1.7. The South African one, I noticed, is now being called B.1.3.
B51.
What's that?
B51.
Maybe it's 351. It's a 3-digit number on the second bit.
Yeah, it's 351.
And then this...
Clever name.
Then this, well, it's a name that only a virologist could dream up. But
I would have called it Becky or Susan, but that's just me.
Yeah.
Go ahead.
And we worry about you sometimes.
I digressed a little bit there. But
people could relate to it more, Then there's this Brazilian one that I haven't seen a designation for yet, but it probably has one. They're all interesting because there's a thought that they're associated with higher transmissibility, maybe also some higher rate of illness or degree of illness associated with them. But on the other hand, the vaccines all seem to still adequately cover the ones that they've studied, and they have both Pfizer and Moderna have studied the UK variant and the South African variant with their vaccines and feel that they still cover them, but they're concerned enough about the changes that they're working on boosters. Again, that doesn't surprise me. I always expected we would need to consider having boosters periodically. It would be surprising to me if we didn't have a situation that's a little bit more like influenza in that respect. But this Brazilian one, less is known about, but what I can tell you is that what's different about the Brazilian one compared to the UK variant, the South African variant, is that even though they've identified these variants in UK and South Africa, and they think that they're responsible for a lot of the disease they've seen recently, nevertheless, their rates are coming down. Their new case rates are coming down, like much of the rest of the world, including the United States. The Brazilian one, though, is a different story. They're actually on an upswing. And so Brazil's a pretty big country. Typically, it's about third or fourth on the list of total number of cases. And the fact that they're having another big upswing now is a bit concerning. And that it's this, they think there's a new variant associated with that that's distinct from the others that we don't know much about yet, is another point of concern. And Brazil has its own kind of, I would say, structural problems. You know, it's really not, it's not a uniformly first world country, let's put it that way. I mean, there are, it's first world in places like Sao Paulo, Brazil, and like that, but they have lots of impoverished countryside, and so the healthcare system and resources are not evenly distributed, and you see stories in the New York Times and elsewhere about how many of the hospitals are running out of basic things like oxygen and so forth, so they're struggling with it a little bit. I cannot imagine that we'd ever have that kind of an issue here. Even at the worst, we didn't come close to exhausting things like oxygen or IV fluids and that kind of thing. So this is a story that's still unfolding, and there'll be more variants besides these ones. So I fully expect that we'll all be doing at least annual boosters for the sort of the latest version or latest iteration of mutations in the COVID-19 virus. And I agree with some people like, well, I haven't heard Dr. Fauci say it, but I think he believes this, but some other folks who are in the hierarchy of the academic centers and NIH and so forth, saying that they believe that COVID-19 will be something that we'll always have with us. It's not going to be like Ebola that kind of went away, and it's not, you know, and other than some little occasional hotspots in Africa, it doesn't trouble the rest of the world. I think that's a different thing. I think we will always kind of have a certain level of what you would call endemicity, or it'd be endemic in much of the world, including the United States, and we'll just have to adjust life around that.
Watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We are taking your questions on the WCTV Facebook page. We're also taking your questions at WCTV Info. If you prefer to use Twitter, we'll get your next question up. My grandmother is entering a long-term facility next week. Are shots available at the nursing homes, or should we get one prior to entering? We were told she will quarantine prior to getting her room.
Well, quarantine on first entering a facility is the normal procedure in every long-term care facility. It may even be a regulatory thing, requirement by the state at this point, but I think everyone does that, so that's normal. As far as the vaccination goes, the long-term care facilities all have CVS or Walgreens, typically one of those two companies, coming in to provide vaccinations, but they're on a schedule. Most of them have had their first opportunity recently or getting it like this week or next, and then then they're coming back a month after that to do, because they're using Moderna, they're coming back to do second shots for those who took it that time, catch any first-timers who are interested and willing and able to take it the second time, and then they go back a third time to catch the second dose for those. I think what hasn't been totally worked out is, you know, if you don't fit into there exactly, like let's say you go into a long-term care facility after their second visit, how are you going to get the first shot? Right. I think that's something the state still has to address. I actually asked that question on a large conference call with Dr. Weaver this past week, or last week actually, and she did not have a ready answer. So I feel like the state hasn't gotten around to addressing that yet. But you know,
so in this particular
the trouble.
Instance, should she maybe come to one of your facilities and get that
Well,
first
possibly.
shot
I
before she
think
goes in?
the problem is that the potential problem is that you need to get the second shot with the same product on the right schedule. And so if you came to the Quillen Center to get, we're given the Pfizer vaccine out and then needs a second shot in 3 weeks, and then you go into a long-term care facility, it's harder to get a plan into place to get the vaccine to you on time. That's not what CVS and Walgreens is taking in. They're using Moderna, which is a 4-week schedule. And so there would have to be an alternate plan to actually bring you out to get the Pfizer vaccine. We do not have a mechanism. We've talked to the state about, can we work out something where we go in to help and do these second shots and so forth, so that we can vaccinate people, but we can't. I can't get the state to promise that there'll be the supply to do that, because it would be outside of our schedule, and they're highly dependent on what our schedule says our volumes are. So there are all kinds of problems that have to be worked out. I think those things will get worked out.
If she
But there
brought her
any
mother
answers today.
to your clinic and got the first dosage before she went to the nursing home, could she go to the nursing home and get her mother and bring her back to the clinic to get the
I
second
guess
shot?
theoretically, yeah, if that's possible.
Well,
Not everybody's that mobile.
Since it would
but-
be easier to do that than to fit into the CVS or Walgreens
Yeah.
schedule, that might be the approach for her to have.
Right.
Let's go with the next question, and we're going to try to get one or two more in, and then
Sure.
we'll check the improving numbers. Are you seeing the yearly flu plus COVID?
Well, it's starting to get remarked on more frequently now. I've noticed in the national media and regional media that we're not seeing very much flu, and that's only the case at Reed. We have seen some. I think we've had a total of 5 individuals who've had COVID-19 plus influenza, either A or B, and I think in one case they had both A and B. So
That's the trifecta.
yeah, they sort of hit the perfect storm on that one. And in every case, those individuals we detected that have COVID-19 plus influenza have been sick enough to be hospitalized. So that's something you do not want in combination, but that does happen. Nevertheless, the volumes of influenza so far have been low. In a typical year, we have significant numbers of influenza by now, even if it's a late peaking thing. Late meaning doesn't peak until March or, into March. I think in most years we're peaking right about now. That we sometimes start in October even, and then maybe to peak in December, or sometimes we start in January to peak in March. But we would normally at this point have significant, much higher numbers of influenza than we have currently, and we just don't have that much. And that's the case everywhere, including the country. So I see more people beginning to remark on that. So flu is out there, but I think all these things we're doing to protect ourselves from COVID-19 are really having an impact on the transmissibility, the transmission of influenza. Plus, I think maybe it's possible a lot more people have gotten immunized to influenza this year. There are probably numerous factors. But I think we know that masking, distancing helps to reduce the transmission of COVID-19. But the fact that we have so much more COVID-19 influenza kind of, to me, it gives is a relatively, it's kind of an indirect indicator of the degree of higher transmissibility of COVID-19 than influenza is.
I know that you all hate looking into your crystal balls on this, but as you look at where we are right now, basically the 1st of February, the number of people you all have been able to vaccinate, the amount of vaccine you all think you're going to have over the next 3 weeks, knowing the number of people that need to be vaccinated, as people start to look out toward summer, looking for an end of this, what are you seeing? What are you thinking you might see as far as large gatherings? Are we looking at fall? Do we still think we'll get some large gatherings in before this summer is over? What are you, yeah, I'm putting you on the spot, but.
Well, it's all dependent on how much vaccine is made available. I think the infrastructure is there to give these injections. So you alluded to that earlier, Tom, that you could give many more vaccinations than you're giving. So could we. I think that's true a lot of places in the United States. The problem is at the factory where these vaccines are made. But I think, looking into my crystal ball, I think that we might see gatherings in early to midsummer. Now, maybe I'm being too optimistic, but that's 6 months down the road. What are your thoughts, Tom?
Yeah, I mean, you have to make the assumption that things are going to continue to improve at the same rate that they are now, which is noticeable. But there are a lot of unknowns into the future.
Sure.
Will there be more waves? Will one of these variants cause another wave? Will we get enough people vaccinated before a wave can start to blunt, mitigate, or even prevent the wave? So many factors in that are hard to anticipate. We do like to try to hope for the best, which is, hey, this is on a good track right now. Let's keep up what we're doing, and hopefully things will continue to improve. And then in that case, I can totally see the governor being comfortable with relaxing restrictions and maybe making mask wearing only necessary for certain situations and not others, and then we could have maybe large outdoor gatherings by summertime, possibly. But on the other hand, we have to prepare for the worst. The worst would be that we have more waves. And so that's why I spend virtually all my time now trying to anticipate what do we need to do now to be ready for the next wave and not just assume there won't be one. And we're working on a number of things in that regard. So I'd like to try to be optimistic about things, but we also have to prepare for the worst. And so I'm not ready to prophesy that we'll all be back to March 2020 life by this summer. It'd be nice if that happens, but I'm not counting on it.
And obviously one of the things driving this conversation really worldwide is the fact that the Olympics that were put off a year ago, that conversation is already beginning, and people are trying to make decisions as to what's going to be happening 4 or 5 months down the line based on this. And from a worldwide standpoint, you just mentioned that there are some places we're having trouble getting vaccine. For them, it's virtually impossible, I guess.
Yes.
We're going to check your numbers after we check one more question. So next one up. What would you tell someone who has had a mild run of the virus and is still reluctant to follow masking and social distancing because their case wasn't that bad?
Well,
take a deep breath.
One of the reasons you mask and social distance is so you do not infect others. There are people who have had COVID. They may still be, it's still unclear at this point whether or not they could still carry the virus at some point. So I think that it would be prudent to wear a mask and to socially distance. And I think that's true of people who've been vaccinated. You get an uneasy feeling when you see someone without a mask on in the middle of this pandemic. You've all had that. You go into a store or somewhere and there's that guy without a mask and just daring you to say anything to him. But those are my thoughts on that question.
Yeah,
I'm sure you can elaborate, Tom.
Well, you've made really 2 points in there that are great, and I will emphasize the last one. I mean, I'm fully vaccinated now. It's been about 3 weeks since my second shot. I'm planning on going to get antibody levels checked just to kind of satisfy my own curiosity about that. I'm looking for somewhere to get quantitative so I can quantify them. That's a little harder to do. But, nevertheless, I'm wearing masks everywhere. Because I think I'm safe, but I don't know very much about what that means exactly. I may be less likely to get sick with COVID-19, but that doesn't mean I can't carry it. We just don't know right now. And then when I'm out in public, I don't want you to worry about whether I'm safe to be around, because I'm not taking the precautions that everybody else is. So I think the prudent, neighborly thing to do is continue to follow the processes until, there is a consensus or direction from health authorities that it's safe to do otherwise.
Why don't we take a look at the numbers that you
Let's
have
do that.
provided us for this week? We've got
Okay.
about 14 minutes left to go in the show.
All right.
Maybe closer to 13.
So this graph you should be pretty used to looking at now, but focusing on the last bar to the right. This data is only through Wednesday. I prepared it a day early, so I'm 1 day short on some of the data. There were about 108 is the last bar on the right, cases. And so that would project out to about 180 for the week. And I've mentioned that I've been constructing sort of confidence ranges around that. So I'm predicting we should have a minimum of about 169, between 169 and 192 with 95% confidence. Last week I had said that we should expect a minimum of about 248. It came in at 244. So I'm going to leave it to you gentlemen to tell me whether that's a hit or a miss on my part.
Oh, that's a hit. I think you hammered it out of the park.
Okay. So that would make me 2 for 3, I think, because I've only been doing those for the last 3 weeks. We'll see how this week turns out. The second graph is again the death statistics as of yesterday morning. The stated calculated total of 161, I think it was, 164 deaths. But since October 1st, that's 149. Now, based on the number of cases since October 1st that are above age 70, we should have a minimum of 181 deaths. So, we're actually quite a bit less than that. So this is actually a good news graph.
Yeah.
The last page is the read statistics. These are the average daily volumes, and maybe the one to focus on is the blue bar. That's total cases in isolation. And it's been a little choppy up and down the last 6 weeks, but basically we're moving sideways at about the same level we had at the height in the spring. But it feels much less intense for a lot of reasons. And but that's how we've been moving. So I'm a little bit concerned that we're not moving down on that quite as much as I would like.
Yeah, it would be great if we could see that coming down. Yeah. But it does seem to be kind of plateauing right there.
And so those are the statistics this week, and we've, I tell you, Eric, something that I get asked about is, what about nursing homes? A lot of people are aware that nursing homes are getting vaccinated. Most of the nursing homes in the region have been visited once by CVS or Walgreens. And the uptake, the percentage of nursing home residents who are taking vaccine is very high, above 95% typically. And so people will say to me, well, gosh, that means there aren't going to be more outbreaks in nursing homes. And I say, well, hopefully that's the case, but there are a couple of mitigating factors there. One is that the uptake amongst staff of nursing homes is actually still very low. Typical in the states, around 30% or less of nursing home staff will take it. That's very disconcerting. Mm-hmm. Not sure what to do about it. Nobody's required to take it, but some people are voicing the concern that, well, maybe we really should make them do it. I don't know how you do that, but that's the thought. But still, that means that those people who don't get vaccinated are more likely to serve as a vector in. And we know that the vaccine's not 100%, so some people will still get sick, and it just won't be as much. Plus, there is a certain amount of turnover of residents in nursing facilities, so they're all the time getting new folks, and others are rotating out for a variety of reasons. So there will be a potential to always have a reservoir of under or unvaccinated residents, which with this vector of staff that can bring it into the facility remaining means that I think we'll still see outbreaks. They'll probably just be smaller, more along the lines of onesies, twosies, threesies, and not huge, large-scale things where 30, 40, 50 people at one time are sick.
Okay. We've got about 7 minutes left to go. Let's see if we can get 2 or 3 questions in before we go today. What would you tell someone who has had a mild run of the virus and is still, I think we just did this one.
No, we just did that question.
Yep, flip. What problems are you finding locally with getting people to vaccinate?
I don't know if this question says to me, what are the reasons? What are some reasons why people don't do it? And it's very interesting. We're doing some research on Reed staff, and about 55%, I think, have been vaccinated. It's hard to pin. You would think we would know, but the problem is that the state's scheduling software doesn't allow us to research that. So we're doing some surveys internally, and we have really good participation. We think it's probably about 55% of Reed staff have been vaccinated so far. Another 30% or so are willing, but they want to wait and see what happens to everybody else. And then there's a minority who are saying that they're not going to get vaccinated. No way, no how. But when you ask them what are the reasons why they're not getting they really don't want to be vaccinated, it's some of the typical things we've heard about. Some people are voicing, the fear. It's the way, even the microchip conspiracy theory comes out in discussing. These are people who work in healthcare, but also concerns about fertility. It's same concerns about it's not adequately tested to know that it's safe, and concerns like that.
Rushed it through. A lot of people say that it was rushed through, and therefore they don't have a lot of confidence in it.
Yeah, exactly.
I had a recovery room nurse tell me she had heard that it changed your DNA.
Yeah, that came out in our survey
I don't know where she got that idea, but
and then we have some others who say, well, I already had COVID-19. I feel like I'm protected, and I just don't need to be vaccinated. So we have answers to every one of those, but the top one is concerns about fertility. And I'm glad that this question was asked because I want to address that. There is no evidence that these vaccines affect fertility. In fact, no vaccine ever has been proven to affect fertility, but these are rumors that typically come out when there's a new vaccine. Same thing happened with the human papillomavirus vaccines a few years ago when those were first released. We do know that when women, if they're not vaccinated, they get pregnant and they get COVID-19, they have a higher risk of an adverse outcome. They're more likely to get sicker. They're more likely to have preterm labor. They're more likely to wind up in ICU or on the ventilator. So when you balance out the fact that there actually is no evidence, it needs to be studied more, but so far there is no evidence of an effect on fertility with this or any other vaccine. And pregnant women who get COVID-19 are likely to have an adverse outcome. To me, that balances toward get vaccinated rather than to avoid vaccination. And so that's how I answer that one. When I don't know that that's a great answer, so we're researching how can we better connect with people to get this information to them. But that is far and away the number one thing that comes out is concerns about fertility.
Okay. About 3.5 minutes left to go. Let's see if we can get one more in. Somebody go.
Would HIPAA not protect against the practice of a
we're trying to figure out the
passport?
question.
Okay.
Well, HIPAA is a privacy law, so is the questioner asking that you couldn't have a vaccine passport because of HIPAA? What are your thoughts?
Yeah, I'm not sure HIPAA really connects very directly to a vaccine passport, and I know that some people have put out there the idea that maybe we need to, in order to travel, some country could have a rule that you can't get into the country unless you bring rock solid evidence that you have been vaccinated. HIPAA protects me as a healthcare provider from releasing your information without your permission. That's a different thing from an airline might say, you're free not to travel with us, but if you want to travel, here's what you got to do to be able to travel. You got to go through security. You can't bring this or that on board. If you're sick, you need to stay home. And then, I guess the question is, could they add to that? And we want you to be vaccinated before we want you on our airplane. That maybe could happen. It maybe needs to be tested in court. I'm not sure how that will come out. But HIPAA is not related.
Okay. But they're asking, you almost have to prove at some places that you've been vaccinated before you can travel. They've already actually started.
Well, you're
that
given
idea.
that when you're vaccinated, you're fully vaccinated, you get a
You get a little card.
Get a little card that tells people the dates and the vaccine that was used and the place where you were vaccinated. So you could produce that as evidence that you'd been vaccinated.
Okay.
Yeah, to your point, there are educational situations where you have to have certain vaccines before children can, normally children have to have those before they can enroll in school places. And there are parts of the world where you can't go now without having been vaccinated against certain diseases. So it's not like this precedent has not been set.
Right.
The question is, how would this apply with COVID-19, especially with these vaccines we have now that have not yet achieved full FDA approval?
That's a good point about other vaccinations, because a lot of these countries, especially subtropical countries that have endemic diseases, you don't get a visa unless you can prove you've been vaccinated for yellow fever or whatever disease is endemic in that region. So certainly there's a precedent there.
Okay. We are about 90 seconds out, so gentlemen, I need to say thank you, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. Thank you again. I think he's made all 44 weeks. Dr. David Jetmore, Wayne County Health Officer. When it warms up, he'll miss a few because he's going to be out on his bike.
Yeah, I just opened the garage door and fired it up the other day just to hear it.
We encourage you to get out this weekend if you can. There is the motor meltdown that is taking place. We do want to remind you of that. If you have a chance to go out and enjoy, the ice carvers have been working very, very hard. So if you drive around the area, you will see some of that. Dr. Jetmore mentioned there are buses in the south parking lot, I think at Elder Beerman. They're also having some movies in the parking lot down there this weekend. So plenty of things for you to go and see and do. Definitely get out and check that out. I want to mention, of course, and this won't carry into our replays, but do want to mention the fact that there is a weather system that seems to be moving into our area. The National Weather Service has indicated that we may see 5 to 8 inches of snow. So you want to be careful of that as you head out this weekend. Go out and definitely have a great time, but be safe. If you have a chance to get vaccinated, definitely do. They both have locations where you can do that. Thanks for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We'll be back with you again next Friday afternoon at 2 p.m. As always, I wish you well. Have a great weekend.
This episode of Ask the Doctors has been brought to you by Wayne County Government.
I wear my mask to keep my family and friends safe. I think it's important to wash your hands because it wipes off the germs. When I play with my friends, we stay 6 feet apart. Keep wearing our masks so we can stay in school. I wear my mask so people don't get sick. I think it's good to wear your mask because it encourages other people to wear their mask.